Understanding the properties of drug half-life is important in identifying how a drug will work in the body, how long the drug will remain in the body, and when it will be excreted, and the relating patient-specific and product-specific factors that affect all of these issues. In this video, we'll talk about what is drug half-life and the factors that affect it. The information presented in this video should not be used for diagnosing or treating a health problem. Consult your healthcare provider before making any changes to your health plan. Remember to subscribe to this channel so you can be notified of more pharmacy and medicine-related videos. Drug half-life is the amount of time required for the drug concentration to be reduced to exactly half its initial concentration or amount in the body at a particular time. In other words, the time required for half of the drug to be metabolized and eliminated from the body. The half-life of a drug is useful in determining the dose frequency. Once the half-life of the drug is known, the time required for clearance can be estimated. The half-life of a drug can vary from person to person and can be influenced by several different factors including age, liver function, and kidney function. It's important to note that a drug's half-life is different from its duration of action or how long its effects last. Half-life can influence the duration of action, but they aren't the same thing. Here is a simple example of drug half-life. The half-life of a drug is an estimate of the time it takes for the concentration or amount in the body of that drug to be reduced exactly by 1/2. The symbol for half-life is T, half. For example, if 100 milligram of a drug with a half-life of 60 minutes is taken, the following is estimated. After 60 minutes after administration, 50 milligrams remain. So remember, the original dose was 100 milligrams with a half-life of 60, meaning at 60 minutes, half of the drug will be eliminated. So after the first 60 minutes, 50 milligrams remain. After the next 60 minutes, at the 120-minute mark, half of what was there at 60 minutes will be eliminated. So you go from 50 to 25. At the third 60-point mark, half of what remained at the second 60-point mark will be eliminated. So you go from 25 to 12.5. And this continues until the product is pretty much fully eliminated from the body. In theory, in this example, we can see that after 300 minutes, almost 97% of the drug is expected to have been eliminated. Most drugs are considered to have a negligible effect after 4 to 5 half-lives of elimination. However, this does not mean that the drug won't be detectable. For example, during a drug test, just that it will not have an effect because it will be below the minimum therapeutic level required for effect. On the right side, you can see a drug half-life graph that describes the example that we just discussed. So why is drug half-life important? For many factors, it is vital that we do know the drug half-life, and it's important in terms of prescribing, changing medications, and managing withdrawal symptoms. Firstly, dose frequency. A drug's half-life can determine how often you should take a medication to get the desired effect. For example, a drug with a half-life between 12 to 46 hours may be ideal for once daily dosing. A drug with a shorter half-life may need to be taken more frequently since it does not last in the body as long. Effectiveness. For medications that are meant to be taken regularly for a certain period of time, the goal is often to reach a steady state concentration in the body. This is when the amount of medication in the blood stays at a general consistent therapeutic level. At steady state, the amount of drug in your body is the same as the amount being removed in a given amount of time. Similar to how long it takes to clear a drug, the general rule is that it takes about 5 half-lives to reach steady state concentration. So shorter the half-life, the effects may be seen more quickly, but may also wear off more quickly. This information can help your healthcare provider know how long they should wait before adjusting your medication. Withdrawal symptoms. Drug half-life is also one of the reasons why some medications have more pronounced withdrawal effects if they are stopped abruptly. For example, the antidepressant paroxetine has a half-life of about 21 hours. If you suddenly stop taking it, there is a higher risk of withdrawal symptoms such as nausea and anxiety. Fluoxetine, which is a drug in the same drug class, uh, it sticks around in the body a lot longer with a half-life of 4 to 6 days, so it can have a lower risk of withdrawal symptoms if stopped suddenly. When considering drugs with a high addiction or dependence potential, those with a shorter half-life are typically harder to withdraw than those with a longer half-life. For this reason, drug treatment programs will often switch a person from a short-acting drug to a long-acting equivalent from the same class in order to improve the withdrawal process. Lastly, interactions. A drug's half-life can also have an effect on some drug interactions. If you're taking a medication with a long half-life, it could still interact with another medication for a period of time after your last dose. A good example is fluoxetine, which can interact with other medications for up to 5 weeks after your last dose. Another example is the antibiotic azithromycin, which has a half-life of 68 hours, so interactions are still possible for several days after you complete treatment. In reality, the half-life of a drug varies from person to person because it depends on a number of different patient and drug-specific factors. These affect how well a particular drug is distributed around a person's body, which is called volume of distribution, or how fast a person excretes that drug, called the drug clearance. For example, the IV drug gentamicin, which is cleared through the kidneys, has a half-life of 2 to 3 hours in a young person with no kidney disease, but its half-life is over 24 hours in somebody with severe kidney disease. Generally, it is difficult to precisely say how long a drug or substance will take to be excreted from someone's body. This is an important fact for athletes or people in occupations that require them to be substance free to remember. Half-lives in the anti-doping world are of limited value because they do not reflect the presence of metabolites, for example, breakdown products of the parent drug, which are often what is measured in anti-doping tests. In addition, serum half-life does not necessarily reflect urine concentrations, which is the main way they take samples for drug testing. In this slide here, you see the patient-specific variables, including age, blood circulation. Very important to point out kidney function and liver function because they are the key points of uh, metabolism uh, in the body. And other things you see, obesity, smoking, and so on. And here you see some of the drug-specific variables that may affect half-life, including the drug formulation, if it's an immediate release versus a controlled release, how the drug behaves in the body, meaning what sort of pharmacokinetics the product has, if it's a zero order, first order, the drug's volume of distribution, does it get into the fat tissue or not, how it accumulates in the body, for example, if the drug binds to proteins or not, does it have metabolites, is it a prodrug that needs to be first converted to the active, uh, and many other variables uh, of, of how a drug is metabolized and cleared in the body, from the body based on its properties. Lastly, just some examples of common medications with their half-lives. You can see a list of about 15 or so products. Uh, what I'll point out here are some of the products which fall in the same category. For example, alprazolam, which is trade name Xanax, of the benzodiazepine class of medications. It has a half-life of 6 to 12 hours, and clonazepam, uh, which is again from the same class of benzodiazepines, trade name Klonopin, has a much longer half-life of 18 to 50 hours. So uh, depending on the patient, specific factors, drug-specific factors, uh, what you're trying to treat, uh, looking at the half-life here may help you decide if you want to prescribe alprazolam, which is a much shorter half-life, versus clonazepam. And then you could look at the other drugs listed here as you're at your leisure. I hope you found this video educational and useful. Please remember to like and share. Thank you.